Sometimes it's very difficult to make the diagnosis of pulmonary hypertension. The patient may experience symptoms which are what we call nonspecific. Things like shortness of breath, fatigue, lightheadedness, things that many different diseases can cause. To be evaluated for pulmonary hypertension, one needs to go through a number of tests to look at the common causes of shortness of breath, or ultimately make the diagnosis of that rarer disease, pulmonary hypertension. Studies that can occur along the way include simple things like a chest x-ray or an electrocardiogram. Oftentimes, the first test that leads someone to suspect pulmonary hypertension is an echocardiogram, which is an ultrasound test of one's heart. If that suspects pulmonary hypertension, or if the physician suspects pulmonary hypertension based on the echo, a few other tests of lung function, tests for blood clots might be performed. But ultimately, the diagnosis of pulmonary hypertension requires a right heart catheterization. A right heart catheterization is an invasive test, usually done in a hospital, but often on an outpatient basis. The patient has an area, usually in their neck or in the groin area, numbed up with numbing medicine, just like the Novocaine that the dentist gives you when you go have a cavity filled. That burns a little bit, but after that you shouldn't feel much pain. A catheter is then inserted into a blood vessel that leads to your heart, and that catheter measures the pressures in the different chambers of your heart and your lungs, and it measures how the blood flow goes through the lungs. And it's based on that data that we know for sure whether or not a patient has pulmonary hypertension.